These are the villages of Tikonko, Lembema, and Torwarma, Tikonko Chiefdom, Bow District in the south of Sierra Leone, West Africa, January 2012. Alice Carpe, the founder of the Rural Healthcare Initiative, RHCI, has returned to her family home in Tikonko Town, along with 2 fellow board members of the organization. The purpose of the trip is to move forward a plan to create an organization and build the relationships that will produce an entire system of healthcare focused primarily on women and children. These members of the community are the most vulnerable and are bearing a disproportionate burden of preventable or treatable disease and death in Tikonko Chiefdom. The chiefdom is made up of 17 rural villages and is home to 47,000 people. More specifically, RHCI will provide mobile services addressing the need for prenatal care, the treatment of basic obstetrical emergencies, malaria prevention and control, and childhood immunizations. That organization, which took root within the Sierra Leone Community of Minnesota, is growing and attracting more volunteers each day.
Principal reasons I'm still involved is the number 23. That is the number of women who will die in childbirth in Tikonko Chiefdom each year. This is a chiefdom of 47,000 people, and if you apply the death rate, maternal death rate, to the number of births in this district, you get 23. So 23 women each year who don't need to die. They're dying of very basic obstetrical emergencies, generally speaking. Each of these women have a family, and often many of them will have other children. Removing these otherwise healthy adults from the community is absolutely devastating. What are they dying of? They're bleeding to death. They are developing preeclampsia and then eclampsia and seizing to death. They are dying of infections. They do so in their villages. There is no medical care for them. There is a government clinic if you can get there. There is no way to get there but to walk for some of these villages. Another number, 271, that's the number of children born in this chiefdom. Again, 47,000 people who will not see their first birthday. And also the ratio, 1 in 5. 1 in 5 children born in this chiefdom do not see 5 years old. And what do they die of? They die of diarrhea, respiratory illness, malaria, stirred in with nutritional deficiencies. These are all mostly preventable deaths as well. We spent some time at the government clinic, and bless their souls, there's 5 people working there. Good people. They're actually trained quite well. They don't have much to offer. And they were immunizing very few children. So as a result, you've got children dying of measles. You've got children getting polio. These are very preventable. It's really basic. You know, immunizations, vaccinations are a best buy in public health as far as what's the cost versus what is the reward.
To understand the state of the economy and healthcare in this West African chiefdom, one has to appreciate that the 10-year war in Sierra Leone resulted in the dismantling of a nation. 50,000 Sierra Leoneans died during those years. There were 100,000 intentional mutilations and limb amputations, including children. The rape of women and girls was an intentional war strategy. 10 to 15,000 young boys, including preteens, were kidnapped and turned into soldiers. 3,000 villages and towns, including those RHCI is partnering with, were completely destroyed. Finally, the conflict resulted in 2 million refugees, some living in foreign camps for a decade or more. That's 1/3 of the country's population.
On the 25th of December 1994, that was the first time the rebels entered into Tikonko town.
6 o'clock, 6 p.m. Prompt, they were in this town.
Amen. So Christmas Day.
It was on the Christmas Day when a lot of people came from all over to spend Christmas in their respective villages in the chiefdom.
Okay.
So rebels attacked us and we all ran to Bo
Okay.
and to some other places.
Okay.
We saw people coming from other villages about 9 miles off from Tikonko. And they told us that rebels are coming. Told them they were coming to attack us here. But we did not believe. We took it just to be an ordinary joke, not knowing that they were coming. So by 6 p.m., we heard the sound of a gun.
Civilians, soldiers,
Yeah.
Kamajors, rebels, it would be difficult to identify who was on whose side.
Right.
So everybody was scared.
Yeah.
Okay.
All good houses in the town were burnt
Yeah.
down to ashes.
Every house was burned down. Everywhere, everyone in the village ran away. Some were killed. Some were able to run away.
They attack us here. We move to Bo. From Bo, we go to another villages where we hide.
Okay.
And my husband was a master farmer. They were running after him because he gets money. So they kill him in this world.
So everything was taken away from the Tikonko people during the war, yeah.
When the war ended about 2000 or so, I think the official date is 2001, but there were still a few skirmishes here and there. What was already an impoverished country was devastated. Infrastructure was devastated. So there were clinics, schools, homes, communities were reduced, either were burned down or were not in existence anymore because of the ravaging effects of the war.
Alice's dream of returning to her home village as a working midwife goes back many years. It was delayed by the murder of her husband during the war in Sierra Leone. Hunted by the RUF, she achieved political asylum status in the U.S. She then returned to Sierra Leone, gathered her 9 children, and brought them to safety here. She labored to become a licensed practical nurse while supporting her children. In recent years, she gathered a number of like-minded Sierra Leoneans around her, who became co-founders of RHCI. RHCI was launched in January 2011 and has been busy building the capacity to elevate the health and economy of a West African chiefdom.